Okay. Now, one thing I need to make very clear is that whenever you get an exam, question about medical ethics, any question, if it's an essay type, or let's say even if it's not very long, I suggest you should write what we just studied, the 4 principles. चाहे जो भी हो आपका क्वेश्चन, ये जो 4 principles हैं आप ये जरूर लिखेंगे, क्योंकि ये आप समझे these are the basic pillars in medical ethics, which is number 1 autonomy, number 2 beneficence, number 3 non-maleficence, and number 4 justice. So no matter what happens, you should write this, whether it's a long question or a short question. This is something that has to be written in the very definition of medical ethics. Let's say you have a small question that just asks you the definition of medical ethics, उसमें भी आप लिखेंगे, तो long question में तो आप लिखेंगे ही लिखेंगे, और इसमें अच्छी सी इसकी explanation भी देंगे, examples भी देंगे. जितना आप example देंगे उतना आप ज्यादा अपना answer ये करेंगे, enrich करेंगे, ठीक है ना? तो आपके actually 2 ही units हैं. I was just seeing. तो जो पहला वाला यूनिट है उसमें तो हमने बेसिक्स तो कवर किए. I'll let you know. हाँ, the first unit is introduction to medical ethics. वो हो गया है ना? उसमें आप ये 4 principles जरूर याद रखेंगे, वो लिखना ही है whenever you get a question on any medical ethics. दूसरा है उसका पार्ट paternalism in medical practice, वो अभी हम करेंगे, और experimentation भी on human subjects. Unit 2 is then the actual questions or actual problems है, वो इंशाल्लाह मैं आपको बोलूंगी before your internal assessment. वो हो जाएगा, let's say आपका 16th को एग्जाम है ना, या तो कल या तो परसों हम वो भी कंप्लीट कर लेंगे. So you're almost done. Just 2 units, which is not that much. Now let's go to paternalism फिर. What is paternalism? Just read this. Paternalism is essentially related to the doctor-patient relationship या provider-patient relationship. आप लिखेंगे paternalism, because this is one of our topics. You write paternalism, and you will start with the definition of paternalism. Firstly, understanding कि ये कहाँ apply होता है. ये apply होता है provider patient relationship में या doctor patient relationship. Provider हुआ health care provider, कोई भी किस्म का. It could be somebody who's making the drug or the medicine, or it could be a counselor. It could be maybe a company that is funding research. So provider is very general. Doctor-patient relationship या provider-patient relationship. Healthcare provider है ये. Okay. So like healthcare providers are primary care physicians हो सकते हैं, कोई specialists हो सकते हैं, nurses या assistants या कोई भी किस्म के related to the field of medicine or medical research. हाँ, ये देखिए यहाँ भी ये यूज हो रहा है. The same values that we used that are coming up again and again, that tells you how important these things are. Non-maleficence, beneficence. So matlab, these are the main principles that define the relationship a provider should have with the patient, or a physician, doctor should have with the patient, which is firstly competence honi chahiye. The doctor or the healthcare provider should be competent. ऐसे नहीं कि उन्हें आता ही नहीं अपना field. So that is number 1. That's why we have medical schools. That's why we have this entire infrastructure that trains, let's say, pharmacologists and people who make medicines, or psychiatrists, psychologists, and physicians. So technical competence is important. Also, not to harm, which is non-maleficence, जो हमने पढ़ा. Acting for the patient's benefit, which is beneficence, वो भी हमने पढ़ा. And keeping patients' information confidential, ये भी आप लिख सकते हैं. This is also an additional. If let me ask you this, where would this be applied? This would be applied in the autonomy कि एक patient एक ऑटोनमस इंसान है, एक फ्री और खुद मुख्तार इंसान है, तो उसकी जो इंफॉर्मेशन भी है उसका कंट्रोल उसी के पास होना चाहिए। अगर आप उसकी इंफॉर्मेशन कहीं लीक कर देंगे, किसी और को बोलेंगे, तो वो उसकी वायलेशन होगी, उसकी ऑटोनॉमी की वायलेशन होगी, एंड दैट इज अनएथिकल conduct. For example, when you go to, let's say, even somebody as simple as a dentist, ethically they should not tell anybody else about your procedure. जो भी आप करा रहे हैं, which is so simple, which is your dental procedure या कुछ भी, मगर ethically they are not supposed to give you out your information, जो भी आपने procedure कराया या नहीं, या आपको जो problems है या नहीं, to other people, except when it is required. Let's say they will tell their staff to do the billing, or they will discuss the case with maybe their colleagues. मगर unethical behavior would be when a patient or a healthcare provider leaks the information, जो कि confidential है, to other people. So, for example, आजकल ये बहुत होता है, and which is unethical behavior, that you have, data leaks from hospitals or from big databases, जिससे पता चलता है भाई इस इंसान को ये procedures हैं, तो then what happens is they are approached by other companies or other hospitals or other healthcare providers कि हमारे साथ कर लो ये प्रोसीजर, हमारे साथ कर लो ये प्रोसीजर। उनको कैसे पता चला जब तक कि लीक नहीं हुआ है? सो दिस इज अनएथिकल बिहेवियर। दिस शुड नॉट बी, मतलब कोई पेशेंट आपके पास एज अ साइकोलॉजिस्ट आए, they are literally opening up their hearts and their minds to you. It is unethical behavior that you should discuss their issues with somebody, with somebody. If you have to discuss, let's say as a psychologist, you will discuss their problems, you will discuss it anonymously. आप उनका नाम नहीं लेंगे, आप बोलेंगे subject या patient को ये चीज है, I am doing this with them, I am doing this therapy, I am doing this procedure. मगर उनका expose करना, oh did you hear फला फला की बेटी has this problem, that is absolutely unethical behavior, unprofessional and unethical behavior. तो ये भी आप लिखेंगे, let's say you get a question on doctor and patient relationship या provider and patient relationship, उसमें आप ये भी सारे लिखेंगे जो हमने 4 पढ़े, and you can add a few कि मतलब competence होनी चाहिए, there should be technical competence in the provider's area of expertise. For example, आप psychologist, आप counselor हैं, क्या आपके पास वो competence है? आजकल हम इंस्टाग्राम पे और फेसबुक और ये सब चीजों में देखते हैं वो mental health coach. You know, there's this concept of just random people becoming coaches, or lifestyle coach. They don't have any degrees, they don't have any treatment, they don't have any qualifications, they haven't studied anything, but here they are telling people that we can solve your problems. If you have mental health issues, if you have some sort of personality disorders, हमारे साथ बात कर लो, हम करेंगे solve. So that is unprofessional behavior. That's one of the you could say the demerits of social media कि unprofessional लोग और unqualified लोग कहीं से भी आ जाते हैं और just because they have the attention on social media, they become experts. मगर उनके पास ना डिग्री है, ना पढ़ाई है। जिन लोगों ने इतने साल लगाए हैं इस रिसर्च में, उनको इंसान बोलेगा, उनको इंसान इग्नोर करता है, और फिर जो ये लोग हैं ना इनके पास डिग्री है, ना पढ़ाई है, ना कुछ है, क्योंकि इन्हें आता है बात-शात करना, इन्हें आता है सोशल मीडिया पे अपने आप को पॉपुलर करना, प्रमोट करना. So people start thinking maybe these are experts, but that's wrong. We need to go to technical competence. People who have undergone sufficient training in their field, they are the ones who can provide the healthcare service. जो आजकल ऐसे ही आ जाते हैं सोशल मीडिया पे, those are people who don't have the requisite training. So ये important है in doctor and patient relationship या provider patient relationship. और एक हमने ऐड किया which is information जो होनी चाहिए वो confidential होनी चाहिए. The patient is literally opening themselves and their private lives to you or to the provider. Their information should be kept confidential. It should be kept secret. It should not be leaked. It should not be shared with anybody else. Okay, moving on. Now, अब हम paternalism पढ़ेंगे, ठीक है? Paternalism. What is paternalism? In a healthcare context, paternalism occurs when a physician, doctor, or other healthcare professional makes decisions for a patient without the explicit consent of the patient. This is important. अभी हमने पढ़ा इससे पहले कि autonomy कितनी ज़्यादा ज़रूरी है. Autonomy patient की समझना कि patient एक खुद मुख्तार इंसान है, अपने decisions खुद ले सकता है या ले सकती है. So we cannot force our decisions on them, even though we know that this is good for them, even though we know that we can cure them, even though we know that we can benefit them, फिर भी, even then we cannot force our decisions on them. They have to make the decision. If they are rationally capable, if they are mature, if they have the capability, they have to make the decisions. So paternalism तब होगा अगर आप देखें in the word paternal बोला जाता है father को. Paternal is like we say, it's used in common language, that the paternal side of my family, the maternal side of my family. So paternalism है आप अपने आप को उनका बड़ा समझ रहे हो, आप अपने आप को उनका father समझ रहे हो, you're taking decisions for them. That is wrong. That is wrong. So there are different arguments इसमें, वो हम जाएंगे अभी बात करेंगे उसके बारे में. मगर normally it is considered कि the patient or the subject has their own autonomy and they should make their own decisions. A physician or any healthcare professional should not make the decisions for a patient without the explicit consent. Explicit consent का मतलब क्या हुआ? या तो उन्हें आपको लिख के दिया कि हाँ भाई I am ready to do this treatment. या तो उन्हें आपको लिख के दिया कि whatever you see fit, I am ready to do that. So एक explicit consent होता है, document होता है, sign होता है, वो होना चाहिए, फिर ही आप treatment कर सकते हैं. Now, अगर वो नहीं होगा, so you have to define paternalism. This will occur when a physician or other healthcare professional makes decisions. If you are making decisions without their marzi, without their consent is marzi, right? Without their consent, without their their decision, without them saying yes, if you are making their decision, you are engaging in paternalism. You are engaging in paternalism. Now, moving on, the physician believes the decisions are in the patient's best interests, but the control in the relationship resides with the physician rather than the patient, much as the control in a family resides with the parents and not the children. तो मतलब mostly, usually, जब ये paternalism होता है, जो physician होता है, he or she believes that the decisions that they are making, they are in the patient's best interests. So they feel that we need to do this. They are in the patient's best interest, but they're taking too much control. You see, they are thinking that they have the control in this relationship, doctor-patient relationship. It resides with them. Just like a parent thinks and knows that I am in control of my children's decisions. So ये अपने आप को बाप समझते हैं. That is when paternalism occurs. When the physician or the healthcare professional starts thinking that they are like a father figure, they are like in control, they are in control of the patient's life and decisions, and they take the patient's decisions without the patient's consent, without the patient, agreeing to that. That is when paternalism occurs. So in the traditional paternalistic model, it was considered acceptable for the physician to decide what to tell the patient about the actual diagnosis. And in the cases of terminal disease, the patient was sometimes not told the true nature of the illness. Perhaps the family was told instead. Or if the patient were informed of the diagnosis, the physician might present the recommended treatment plan as the only one rather than mentioning alternatives that could be considered. Or if the patient were told of alternatives, the physician might make the recommended treatment plan seem clearly preferable in order for it to be chosen. तो मतलब paternalism के बहुत सारे ये होते हैं, किस्में हैं. In various ways, you can commit paternalism. For example, you can say you won't tell the patient the whole story. You won't tell the patient the actual problem that they have, or you won't tell the true nature of the illness. Is it going to kill the patient or not? मतलब आप full information जब नहीं दे रहे हैं, you are committing paternalism. Or even if the patient is informed of the diagnosis, the physician might present the recommended treatment as the only one rather than mentioning the alternatives. Acha, so the physician, even if they inform the patient of what the disease that they have or the disorder that they have, but when it comes to now giving the treatment, they will not fully inform the patient about the different treatments. They'll only present one treatment as the only, perfect solution, as the only workable solution for them. That is also a kind of paternalism. कि मतलब ना तो आप full या तो आप इनको full decision ये full information नहीं देते हैं about the disease, about the diagnosis of the disease, about the diagnosis of the disorder. So you are hiding some information for whatever reason, good or bad. Many a times doctors do it for a good reason. Maybe they don't want to scare the patient, or they'll tell the family. मगर फिर भी they're taking the decision on, for themselves. They are not considering the autonomy of the patient. So ये एक किस्म का ethical issue बनता है. Number 2 है, या तो आपने पूरा तो बोल दिया ये क्या है, डिजीज क्या है, मगर ये पूरा नहीं बोला कि ट्रीटमेंट्स कितनी सारी हैं. एक ही ट्रीटमेंट बोल दी और उसी ट्रीटमेंट को सबसे बेस्ट बना के प्रेजेंट किया. So that means you haven't given the full information to the patient. Again, you are making the decision for the patient. You are not giving them the full control over their life to choose the alternatives, to choose which treatment they want. Or if the patient were told of the alternatives, the physician might make the recommended treatment plan seem clearly preferable in order for it to be chosen. So even if they, let's say the physician says, हाँ ये बहुत सारे, there are many alternative treatments that you can take, treatment A, treatment B, treatment C, but somehow in my tone, I will prefer treatment A जो है ना वो treatment A आप ले लें, या treatment A is like amazing. So I'm making your decision for yourself. I'm not giving you a balanced picture. I'm not giving you a balanced picture. I'm making your decision for, I am making your decision. Whereas it should be you who should be making your decision. तो ये सब paternalism हो रहा है. ये हो रहा है कि let's say I'm the healthcare provider, I'm the psychologist, and I'm treating you, let's say. Now I am acting on behalf of an authority over you. I'm thinking I have some authority over you. So this is called paternalism. When the provider, the healthcare provider, or the physician or doctor starts making decisions for their patients and does not give them full consent, does not allow them to give full consent for the treatment, that is when paternalism occurs. And there are different ways in which it can occur, as we just studied. Acha, it can occur even outside healthcare. A typical parental decision in the family are paternal. So this is where we see, they're trying to make us understand what paternalism essentially is. Acha, let's read this example. For example, a surgeon performing a surgical procedure on a patient will use the techniques he or she feels best fit the situation rather than asking the patient for advice or presenting choices to the patient about the technique throughout the operation. Or in deciding upon medications to try to treat an infection, the provider will narrow down the field of possibilities to ones that, in his or her professional judgment, are likely to knock out the particular type of infection rather than presenting long lists of antibiotics to the patient so that the patient may choose. मतलब this occurs in various ways. Paternalism जो है इसके अच्छे sides भी हैं. पैटर्नलिज्म के अच्छे साइड्स भी हैं कि अब हर चीज तो डॉक्टर नहीं बोलेगा ना. देयर आर सो मेनी थिंग्स दैट द डॉक्टर डज विद द पेशेंट that we are not given asked full consent for everything. Let's say surgery है तो उसमें तो डॉक्टर ये नहीं बोलेगा ना, अच्छा अब मैं ये आपका काटूं, do you give me the permission to do this? Okay, I'm now going to cut this or burn that or sew this or you know so many different things, so many different procedures. Now the doctor will not ask for permission and will not seek your consent for everything. There are decisions sometimes the doctor has to take बिल्कुल मतलब ऐसे ही ऑन देयर ओन. फॉर एग्जांपल जैसे हम देखते हैं इन द केस ऑफ इमरजेंसी, कोई इमरजेंसी है, बड़ा सा कुछ हो गया है, गॉड फॉरबिड किसी को, और इट्स बेसिकली ईदर द पेशेंट बिल्कुल डेथ बेड पे है and now the doctor has to take a decision and it has to be fast. Many times this happens in the emergency room. They cannot wait for consent. फिर कोई आएगा, फिर sign करेगा, फिर ये, फिर वो. So they just start the procedure उसी वक्त, and without thinking, without giving, without any discussion. तो उस वक्त paternalism is being used. The doctor is using their own decision. The patient at that time is not in the position to choose. The doctor is choosing for the patient. तो paternalism हो रहा है वहां, मगर उस वक्त और कोई ऑप्शन ही नहीं है. तो जैसे फॉर एग्जांपल आपको पैटर्नलिज्म में क्वेश्चन आएगा तो आप ये दोनों पहलू दिखाएंगे, है ना. ये वाला पहलू भी आप दिखाएंगे, जैसे यहाँ ये लिखा है, इट इज इनएविटेबल दैट प्रोवाइडर्स विल एक्ट पैटर्नलिस्टिकली इन एन इनोक्यूअस सेंस फॉर मच ऑफ व्हाट गोज ऑन इन हेल्थ केयर. मतलब ये बोला जा रहा है कि पैटर्नलिज्म होता ही रहता है, क्योंकि देयर सो मेनी सिचुएशंस जहां आप यू हैव नो अदर ऑप्शन but to take the decision fast, otherwise you lose the patient. So for example, a surgeon performing a surgical procedure on a patient will use the techniques he or she feels best the situation, rather than asking the patient for the advice or presenting choices to the patient about the technique throughout the operation. So operation may be there's so many, even though agar aapne unse consent ली भी होगी, मगर मिड ऑपरेशन कुछ ऐसी कॉम्प्लिकेशन आ गई, यू हैव टू टेक अ कंप्लीटली डिफरेंट डिसीजन ना, उसके लिए आपने लिया नहीं है फॉर एग्जांपल ये कंसेंट, फिर क्या करेंगे आप. तो paternalism is being practiced within the medical field, within the bio research field many times, but we have to understand what is good paternalism and what is bad paternalism. Good paternalism would be where the healthcare provider has no other option. It's very important that you people have these professional skill enhancement courses hai, because even if let's say we are not in the medical field, but at least we understand our rights within the medical field. So whenever we do undergo procedures, we know what are our rights as patients. Or let's say you are in the medical field, maybe you are a psychologist, or maybe you will go into medical practice of any sort. So this is obviously telling us how to act ethically in the field. Achha, now deciding upon medications to try to treat an infection, the provider will narrow down the field of the possibilities to ones that his or her professional judgment are likely to knock out the particular type of infection rather than presenting long lists of antibiotics to the patient so that the patient may choose. मतलब कभी ऐसा decision होता है कि you have to make the decision yourself. The healthcare provider will have to make some decisions themselves कि अब कौन से drugs इसको administer किए जाए, क्योंकि infection इतना तेज है और इतना harmful है, either we lose the patient or we'll have to take a decision fast and give them this list of antibiotics. So this is where paternalism is being used but there is no other option. It has to be used. Acha. Or in deciding on what kind of continuing professional education conferences to attend or what professional literature to read, the provider will not solicit patients' advice, patients for advice, but rather use his or her own judgment about what new knowledge and training will likely best benefit his or her patients. Obviously, जो health care provider हैं, let's say psychologists हैं, तो अब नई नई रिसर्च हो रही है, तो फॉर एग्जाम्पल एक नई ब्रांच ऑफ साइकोलॉजी डेवलप हो रही है, और आपकी जो साइकोलॉजिस्ट है या आप साइकोलॉजिस्ट हैं, तो आप वो नई ब्रांच में और ट्रेन हो रहे हैं, उस वक्त तो आप पेशेंट्स की कंसेंट नहीं ले रहे हैं कि मैं ये पढ़ूं। बाद में आप तो वही वाला फील्ड अप्लाई करेंगे अपनी प्रैक्टिस में, मगर उस वक्त आपने किसी की कंसेंट नहीं ली। यू आर टेकिंग द डिसीजन फॉर योर ओन सेल्फ। ठीक? So that is paternalism being used. Okay. Now, arguments. So you have to understand there are arguments for paternalism and there are arguments against paternalism. So वो हमने पढ़ लिए कि क्या है, for क्या है. One common argument for paternalism in healthcare is that the physician or the other provider has such vastly superior technical knowledge of the medical situation, the certainty of the diagnosis, the nature of the treatment options, and the possible benefits and the risks involved that it makes more sense for the provider to evaluate the options and make the decisions. मतलब कि सबसे बेस्ट आर्ग्यूमेंट जो पैटर्नलिज्म के लिए है वो ये है कि फिजिशियन जानता है सब, जो जानती है सब, जो साइकोलॉजिस्ट है वो सब कुछ जानती है, जो भी हेल्थ केयर प्रोवाइडर है वो बहुत ज्यादा नॉलेज रखते हैं, उन्हें पता है रिस्क क्या है, उन्हें ये पढ़ा हुआ है, उन्हें पूरा डायग्नोसिस का भी पता है, तो बेस्ट डिसीजन तो उन्हीं का होगा, जो भी वो डिसीजन करेंगे वो उन्हीं का बेस्ट होगा। सो दिस इज द फॉरमोस्ट फर्स्ट आर्ग्यूमेंट फॉर paternalism in favor of paternalism. तो patients जो हैं they are easily overwhelmed by technical details and risk talk and are therefore not in the best position to make the decision. So ये है argument for many a times you see you have patients who are not literate. They know they have an issue, but they're not very, they're not educated. गांव के कभी आते हैं या कोई किसी ऐसे घराने का जिनको ज्यादा समझ या पढ़ाई नहीं है या कुछ नहीं है, उस वक्त क्या आप करेंगे? अगर आप उनको वो बोलेंगे जो रिस्क्स है और पूरा इंफॉर्मेशन देंगे तो वो तो डर जाएंगे। तो उस वक्त arguments for paternalism are used in favor of that you will have to make some decisions on your own. You can't take the complete control, मगर some control you'll have to take. Okay, so patients are weak because of the illness. वो भी एक चीज है. So these are all the arguments for paternalism. Arguments against paternalism फिर यही है obviously जो हमने पहले पढ़ा कि patient is autonomous. Patient की अपनी का अपना इख्तियार है अपने ऊपर. That has to be respected. Patient खुद एक rational इंसान है, लॉजिकल इंसान है, खुद ले सकता है अपने डिसीजंस, समझ सकता है उसके लिए क्या अच्छा है क्या नहीं है. So we cannot, we as healthcare professionals or healthcare providers, we cannot take decisions for themselves. We can only inform them. So that is the argument against paternalism. So and obviously इसमें बहुत सारे cases हुए हैं where without the consent of patients they were given treatments and they were harmed in that case. So that means history is filled with these things. Even in the US में तो बहुत सारे cases है ऐसे. 1970s में there were groups of people who were tested upon, who were given various kinds of treatments. बहुत बार हुआ है ये, and the history is filled with these instances where people without their consent, even children, some people don't even spare children were treated with things that harm them. उनका children, obviously children cannot have consent. बच्चा क्या बोलेगा? बच्चे की कंसेंट नहीं है, माँ बाप उनको बोला नहीं गया या उनको समझाया नहीं गया, and all of this research was done and there have been so many cases where children have died, people have died. You can read about them. on the internet, this big billion dollar cases. फिर उसमें बहुत सारे people, they filed the court case against the company. The company had to give a huge amount, but still the lives were lost. What will money do? है ना? तो this is important. Autonomy इसमें सबसे बड़ी चीज जो है arguments against paternalism, which is autonomy. कि मतलब एक इंसान खुद मुख्तार है. You cannot take the decision for themselves. And these are impermissible. These are the actions that are impermissible. Within this discussion of paternalism, if you are failing to inform the patient of the true diagnosis, if you are not disclosing to the patient other available, acceptable treatment options, if you are lying, let's say there are people who are lying or withholding information, because many a times there are situations where the healthcare provider is given sort of incentives, some sort of benefits by drug companies, by pharmaceutical companies कि हमारी दवाएं इस्तेमाल करो, इन्हीं को प्रमोट करो, बाकी दवाइयां नहीं इस्तेमाल करना. तो फिर वो क्या करते हैं, क्योंकि ये तो अनएथिकल बिहेवियर, वो उन्हीं दवाइयों को सिर्फ प्रेजेंट करते हैं अपने पेशेंट्स को एज सॉल्यूशंस. So that is unethical behavior. So if you're making important decisions for the patient, instead of allowing the patient to make them, this is bad paternalism, arguments against paternalism. And the second assumption of healthcare paternalism mentioned above is that the provider in fact knows what is best for the patient. ये तो हमने पढ़ा. So almost we are done. I'll just share with you this document as well. Okay, now we need to go to human experimentation, but just give me a second. Ye wala. Yes. Human experimentation, maybe a basic, I'll give you basics into this. Let's see how much time we have on the meeting. Just have 3 minutes. Let's just complete this. Now, human experimentation आप लिखेंगे, अलग किस्म की human experimentation होती है. कभी sometimes to check the efficiency of drugs. कभी sometimes, human experiments are done to check the harms of drugs. They're different, or products. Sometimes, even in the cosmetic industry, कोई किस्म की का cosmetic बनाने के लिए use कर सकते हैं ये. And there are different kinds of human experimentation. So it can have different meanings. Indeed, with the development of medical research, therapeutic acts have to be distinguished from acts of cognitive values. मतलब therapeutic, आप therapy किसी को दे रहे हैं, वो एक अलग चीज है, और आप किसी को समझा रहे हैं या उनको बता रहे हैं, वो एक अलग चीज है. These two things have to sometimes coincide, and that's what we'll learn now. For each kind of act, specific conditions of acceptability and specific protections. Okay. Okay. Human experimentations must be envisaged or must be viewed at different levels to evaluate ethical aspects. Scientific value क्या है उसका? Risks क्या है? Benefits क्या है? और populations जो involve होंगी वो क्या है? So this is important. You should write this down. कि human experimentation must be viewed at different levels to evaluate the ethical aspects. What is the scientific value of this human experimentation? What are the risks? What are the benefits? And what is the, will there be a specific population that will be implicated? For example, I'll give you an example and we'll end this because this meeting will end. For example, benefit भी हो सकता है human experimentation का. कोई बड़ी सी बीमारी, let's say, फैल गई है हर जगह, or we need to test its efficiency. Now, obviously, rats पे test करेंगे, मगर rats तो इंसान है नहीं ना. We would need human beings at the end of the medical research. Every drug has to be tested on human beings. मगर उसमें क्या है? उसमें होना चाहिए, it should be very transparent. Transparent in the sense you are asking for consent. आप पूछ रहे हैं उन लोगों को, उन लोगों को पता है ये क्या हो रहा है, ये रिसर्च क्या है, ये इसके बेनिफिट्स क्या है, इसके हार्म्स क्या है. दे शुड नो ऑल ऑफ दिस. दे शुड बी कंप्लीटली इन्फॉर्म्ड. एंड उस वक्त अगर ये एक्सपेरिमेंट उन पर किया जाए तो फिर वो एथिकल भी हो सकता है. That will be an ethical human experimentation. Now I'm going to end this, and I'll let you know what we'll do. Should we complete this today or next class? Mein, I will let you know in your group.